What are the things that are overlapping, right? So at least that can help you as a teacher or parents, even for yourself, can get help. Just learning about this topic. I believe that all these topics are chosen by your own leadership. So probably you do have some of those issues among our children who you are taking care of. So let's go over autism spectrum disorder and ADHD. Autism spectrum disorder, one thing that we needed to understand, the word autism often tied it into strong stigma as well, because if you see the timeline of 2013, okay, draw the line of 2013. Prior to 2013, there's an autistic disorder, often associated with autism, right? So autistic disorder often comes with severe conditions. They cannot leave themselves, banging, self-harming, and they cannot function day-to-day of their own life. They need assistance. So that's the category of autistic disorder. And another category is people who are often struggle with social issues that used to be called Asperger's syndrome. So that used to be in that diagnostic, the manual, but after 2013, they updated, and there's no more Asperger's syndrome in our diagnostic, especially in a clinical setting. So that's why there's a lot of a confusion. But some people who grew up in my age or a little bit older than me, even like maybe up to the millennium, so that's still more comfortable with Asperger's syndrome, because Asperger's syndrome is functional, but they have difficulties with the social and relational issues. But those are all gone clinically and combined, those two and many other areas. For example, pervasive developmental disorder, sensory processing disorder, those are all gone from the prior to 2013 and combined under autism spectrum disorder. That's why right now, current time, since the 2013, autism spectrum disorder, prevalence of autism spectrum disorder has been increased tremendously. And also, more than 90% adults who are diagnosed with high function autism spectrum disorder after age 50. We have many also pastors, elders, missionaries are coming even with these issues because they have difficulties with the relationship. Right? So, because it's very, very functional. So autism spectrum disorder, when you're listening or hearing today, at least the one thing that you can see is a spectrum. It's not autism spectrum disorder means that you are autistic, that you cannot function. But there's some area that maybe you are struggling with. And ADHD, again, is a kind of popular, especially for your parents. Behaviorally, academically associated with it a lot, but we're going to distinguish a little bit. So why don't we go through that? But before getting into the more of a clinical, since you're all teachers, before we are pathologizing or looking at those behavior issues with the disorder, I want all of us to understand our children are human beings. Which means, all our children, including adults, we need to be safe. Our children are required to be protected because they themselves cannot protect through their own environments or how to manage their behaviors. But we, adult teachers, pastors, parents cannot be the source of a threat. It could be your good intention, wanted to discipline your child, but if your child is feeling threat by you, unsafe being around you, something is not right. Whether they have ADHD or other conditions, All our children need to be protected and have to feel safe. All our children needed to be seen who they are, not depending on what they do, how much they are accomplished, what kind of a performance they can do well or not, A and B or D and F. They have to be them. But we are also grading our children by seeing them by behavior rather than looking at them who they really are, especially in our church, that they are created by God's image, that we have to see them as a child of God rather than by their performance and behaviors. All our children also, they sometimes don't know what they are experiencing internally. Either it could be internal or external, that when they're feeling not comfortable, we are the adult who need to soothe them rather than yelling at them. They don't know what's happening in them. They are crying out to be comforted, but we are yelling at them, spank at them, or often ignore them rather than comforting them. All children needed to experience being safe, being seen, and also soothed by their parents or caregiver so that their identity can be very secure as they grow up. It's not about what they do. Again, it is not about what they accomplish. It is about who they are, that they have to be comfortable and be secure. This is all our children, okay? Even more for the children who are struggling with the mental health, especially with ADHD and autism. I don't know how many of you grew up with Mr. Rogers. Raise your hand. How many of you know the Mr. Rogers? At least, did you watch the movie about him? A couple of years ago, I made it about him, like a documentary. He was a pastor and also children's minister who saw that media is so powerful that they are watching violence and inappropriate types of a movie. So he got called that I want to use media to the minister to the young children. So he created this shows, Mr. Rogers. If you have a chance, I will highly encourage you to watch as a teachers and as a parents. I didn't grow up with him, but I heard about him, so I watched a couple of episodes and a movie and documentary about him. This is one of the episodes that Mr. Rogers said to the young children. He was minister. He all recorded it, right? This was his ministry while he was alive. And he was telling them that human beings learn. Any human beings, even especially for the children, learn best and most from another human being, especially from people who really care about them. I want you to really think about this. Our children will learn best, the most, from you. Because you are the one who will care about them. How you engage, how you express, how you created a safety and soothe them and secure the environments, make them to learn the value and sense of who they are, and also how they can treat other people. If your child or even at church, they are violent, they probably learn from somebody who are very closer to them. If your child is yelling back to you, then probably this is something that they learned, and that's the only way they can express their needs. So I want all of us, especially church leaders and parents and teachers, remember that children are observing you every day. Okay, our relationship is the way our children, after they are born and then coming out from the mother's womb and starting a relationship, is already social. So every engagement, every relationship will implement and also imprint in them how they think about themselves and how they think about others. And they will think about who they are or how they feel about themselves and how they feel about other people. A lot of our parents who are coming to our clinic were saying that, oh, my child doesn't have a self-esteem, self-confidence. Can you help them? Self-esteem means the feeling that they have about themselves while they're interacting with their parents. So, although I am licensed psychologist, something that I cannot fix. I can help them, right? Because the feeling that they are getting it is the way you're treating them. That feeling, they are internally having it, and internally sometimes having that as their view and ideas and opinions about themselves. So this feeling and thinking that we are developing in our mind is all through the relationship, starting from their parents. And then things that what they remember, the things that they remember, or what you remember are different. One time, is a part of my doctorate assignments in class, that they ask us to go back to the parents. Is something very negative memory that we have about them. So we have to go and then talk about it. So I went back to my mom. Mom, I remember when I was 6th grade. Why did you do that? You know, I still remember that. It was terrifying for me, and I don't know why. I still don't know why you did that to me. And my mom said, what are you talking about? I don't even remember. But that we remember something that's very significant to us through somebody else in their relationship. So things that you remember is a very negative. It could be perceptually a little different than other people's, what they remember about the situation. And then because of that, through the relationship, now we respond in behavior. So our relationship, in a way, that shapes the way we think, the way we feel about ourselves, the things that we remember, and how we engage with one another. It started from our parents and teachers, especially people who are very closer to them. So now let's talk about, with that understanding, okay, that one doesn't change whether they have ADHD or ASD. Okay? All our children needed to experience all that safety. But the ADHD, one thing that I want to highlight here, ADHD and autism spectrum disorder, I will call it ASD in a shortened way of saying it, is a neurodevelopmental disorder. Neurodevelopmental disorder, which means it starts early in childhood, very young. Sometimes we are able to detect around the age 12 months. Before they hit age 1, we can observe those signs. And we do have certain tools to even assess those areas. So it starts early childhood, and it affects how their brain grows and also functions. Okay? So please remember, this condition is a neurodevelopmental condition, which means is a brain function. It's separated from who they are. Your child is your child. But as they grow in a childhood, some of the area in their brain functions are not developing according to what we expect, like a developmental milestone, right? And also, one thing that why we cannot blame our children the way they behave, especially under this condition, is a genetic. If your children have some issues related to the attention difficulties and ASD condition, one of you or the parents, one of the parents or both parents have it. Our children cannot just develop by, environments. It's strongly related to the genetic. And also, autism spectrum disorder, ASD, if they have a condition of ASD, it's very, very common that they will have ADHD as a comorbid, but not the other way. ADHD is similar, kind of have a little bit of a traits of ASD, but not meeting the criteria for diagnosis, right? So ASD can have ADHD, but ADHD have a similar signs, but not for the ASD. Okay, all our children, if you want to know, and if you want to help your children's parents, I will recommend you to go on cdc.org. Then there's a developmental milestone checklist. So one of the questions during the first lecture, that if we notice something, we don't know how to address or how to tell the parents, then I will actually recommend for them to go back on cdc.org and find the developmental milestone checklist. It's actually starting from the infant to the age 5. It's kind of created a category, physically what we expect for age 1, age 2, up to age 5. Emotionally and socially, all those guidelines are there, why that is so important, right? So it is more of a developmental related issue, so you can use that part. And as soon as they are born, recently actually, very recent, I think within the last maybe 1 or 2 years, neuroscientists studies about the baby's brain. Babies, infants, they don't know anything. They're just looking at you, blinking their eyes and smiling, sometimes crying, eating, and pooping. But they study. This is amazing parts about the technology and the medical advancement. Even about 20, 30 years ago, the reason why mental health was so taboo and shame-based, even in church, is because no one was able to see the brain activity back then. That why now so many people are so aware of the mental health, because now you read your brain through the technology. MRI. As a functional MRI can actually dictate your different parts of the brain, how they engage and interact. It's amazing, right? So they study about last year or a year ago, the neuroscientists studied about the baby, infants, first years old. They discovered that within 2 months, when they are looking at their parents, they were able to distinguish is a human or non-human object, and their brain activity is changing. Seems like you're not that surprised. So now brain study is so advanced. Even they study the 2-month-old baby was activated when they're interacting with a human, living being, compared to the object. Even the object looks like human being, but there's no lives. They were able to distinguish. Let's talk about our brain a little bit then, okay? So probably you heard about that a lot, left brain, right brain, right? So the reason why this is so important, children who are born up to age 3, they don't have left brain ability. Up to age 3. Up to age 3, they use and access about their right brain 100%, which means everything is through senses. Sounds. My mom is talking to me with a soothing voice or a yelling voice. That's it. That's yelling, then threat, scare, right? And then there are also smells that disgust, so they vomit if things are not pleasant to them, right? And then they're physical, right? Whether our parents are soothing and rubbing them or hitting them, the senses are there receiving it. So up to age 3, they're using this right brain, try to survive by reading other people around them. They have no ability to protect themselves, but crying and try to away from. It's just a human instinct that they needed to survive, but they don't know why that is happening. And then starting for age 3, you probably notice that children are asking, why? Why? What is that? Why? Because now their left brain ability is start to build. And then putting reason together. So my mom's dad's yelling is anger, which means they don't like me. Make sense? So up to age 3, I heard that this church has an infant ministry. Up to age 3, if we can, we have to practice how to whisper. Okay? And then how to soothe them. That is the best way that we can engage and allow them to inner being to build with the safety and secure. Alice, during the first lecture, was mentioning that as children are developing their brain, upper parts of the brain is more of a reasoning, making decisions and higher level of thinking. The bottom is more of your central nervous system is connected to the inner midbrain, but we're making it under because that's the area that is amygdala limbic system or central nervous system that is survival. Okay? So the children always use that one first because it's connected to their body. Right? So they have to use the central nervous system to protect them, but they don't have ability to think and make a decision. Oh, my mom had a bad day. Oh, my dad is unemployment, so that they are not doing well. No ability. It's all about the midbrain survive. That's why the limbic system, amygdala, is very, very central of our brain. That's how God created it, because it has to protect it to survive. It is a very, very important concept that I wanted to share. So autism, let's look at it. Again, is a lot of information, but I want you to remember 3 categories. Not everyone to be autism spectrum disorder, but again, degrees are very different. But we have to have 3 categories that they are functionally having difficulties with. Okay? Social interaction is more of how they're related to other people. And then communication, how they communicate with the back and forth. Okay? And also behaviorally is restricted or repetitive. Let me just get into a little bit more, kind of more of a real life issues, right? So children's, a social norm is when children see the other adults have to say hello, but they don't respond with a hello. The interaction is already disconnect. And then they're able to say hello and communicate verbally, but they cannot pick up the subtlety of social cues. They have difficulties of reading the rooms. Sometimes they say the mean things, think that that's fun, or that's funny. Okay? Or sometimes they can be very social, they can be very verbal, but they interpret things utterly different way. So their perceptual, their perception taking is very poor. So suddenly coming back from the school or coming back from the church, they were saying, my teacher hates me. That extreme way, because he or she gave a compliment to other students, but she and he never gave me, and then interpreted it like they hate me. Right? So that's the kind of way. But restricted and repetitive behavior is a very narrow interest. If an area that they are very interested in, that you cannot stop them talking. They cannot do it back and forth what's interested in you. And then they're also very rigid. and inflexible. So hard to transition from one to another. If one activity is done, we have to move to another activity, but it will take forever. And also, there's a huge part that included autism spectrum disorder, as I said, the sensory processing, information processing disorder. But back then, it was sensory processing, but no longer available. That's also under autism spectrum disorder. So if they have this sensory over, hyper, and hypo, sometimes things are happening, they don't respond. It's more of a hypo. As hyper is they just so sensitive, everything is too much for them. And that sensory is more of an environmental. And then often you will see young children, they melt down, is a little more out of proportion. And then you will not be able to calm them down. Right? Take many, many hours to calm them down. So another category that often we actually needed to educate the parents during the developmental milestone related to the ASD is neuromotor developmental issues. It's more of a motor issues, again, related to the brain. So children are kind of potty trained is kind of late. And they have to wear the diapers when they're first grade. It's something that you have to look into. Or bladder, they cannot control, so they're wetted too long, more than a developmental milestone expectation, and that could be another. Or sometimes you can see more of a clumsy. They're constantly dropping something, bumping to other objects a lot, is more of a neuromotor issues that we always needed to screen that. So again, all of these differences are degree. That's why it's a spectrum. Some people have one or two more severe and other area less, right? Or sometimes they are so smart or more of a savant level that they can be so good. You never taught them, but they master themselves, but other area that they cannot do well. Again, if it is the ASD, this one is more of a functional changes. It will continue after the elementary school. If it is more of a high function, it will come out during the middle school and high school, sometimes in adulthood, because they are masking it, and then they will be able to do it by learning, but they have difficulties of engaging or connecting. So often the people who are coming to us quite late age. Okay, let's look at the ADHD. Probably you heard about this a lot, and prevalence of ADHD again is growing tremendously. And maybe almost every day we're diagnosing somebody with ADHD, especially in the college students. But the children who have ADHD-like symptom in early age, okay, it will not gonna go away. Especially if it is related to the inattentive type. And I will go over that. So inattentive type, if you see young children, they behave really well during the worship time. When they have a Bible study, they will be able to sit down and looking at you. But almost like they are staring at something in the air. Or zoning out, spacing out. And then they're always turning their assignments late or incomplete their task or assignments. Right? We can see that they are smart, intelligence, but always the things are prompted by the parents. Always parents needed to remind, did you do your homework? Did you finish your homework? Did you do your chore? Right? It's a more of an inattentive type. And very difficult to organize their room. For them, they can find their items. But from other people, it's very disorganized. Okay, that's the more of an inattentive type. So ADHD comes with 3 different inattentive type. And hyperactivity is more of kids cannot sit still. During your worship, first 5 minutes is enough. And they needed to walk around, poking next, the kids, or raising their hands constantly, or going to the restroom constantly, blurting out, cutting off other people is more hyperactive and impulsivity. Interestingly though, kids who have this type, hyperactivity and impulsivity type, they come to us early because teacher noticed by behavior. parents noticed by behavior. They cannot yell at them, scream at them all the time. So finally, they come to us. But inattentive type take a long time because the parents say, my child is good, they behave well. But oftentimes comes with a later age. And I even treated and diagnosed somebody who is already a physician and lawyer. But they have intelligence to do learning, but they cannot manage day-to-day lives. Again, executive function. So another type is these two are combined, right? So impulsivity and inattentive type, hyperactive impulsivity, combined type. So inattentive type, hyperactivity type, combined type. Depending on the type, the prescribers are treating them differently. Let's look at that then. Why ADHD and autism often misdiagnosed or overlooked or underlooked. Because when you're looking at it, I don't know, you can see clearly actually. Hope that this slides will be provided to you later. So when you are looking at it, there's a lot of symptoms are overlap, like ADHD and like ASD. But when you're looking at it, it's quite different. For example, fidgeting, right? So ADHD individuals are shaking their legs a lot. When they're talking, if you say, oh, ADHD, right? They're shaking their legs a lot. Maybe it could be because of the anxiety, but often is because of the boredom. They have to shake something or move something in order for them to focus. But the ASD's stimming behavior, shaking or flapping or tapping or whatever that is, right? The stimming behavior is make them feel comfortable. It's two different things. Okay. Again, please remember that these both are signs started in early age. So if you notice any of these symptoms, don't think that it will go away. At least get help so that if a provider said, no, it's okay, it's a part of the developmental, then you don't have to worry about it. But if you ignore and later it will happen, we have to go back all the way while they're already developing how they feel, how they think, how they remember, how they behave already. Then we needed to do a lot more work internally more than externally. And oftentimes our parents, especially inattentive type of ADHD, parents say, oh, my child seems so lazy, not trying their best. But what if that's not them? It is more of their brain function. Then we have to help them. It's so unfair. If one of you are struggling with this, please, this is so unfair. It's not about you, but look at our society and our school system. They're looking at everything according to their behavior. And then we are doing the same thing. If you do well, you're good kids. You're not doing well, you're bad kids. But it's nothing to do with them. It's more of their brain. I'm sorry, I'm a little bit passionate about this area. So if we see those children, so we have to nurture them properly and at least tell them, it must be very hard. I know you want to try to do well. It must be very hard. Even with your effort, it's not working. No one knows how lonely that could be. It must be very hard. Because when you're asking our children, even worse kids who are coming to our office, I'm asking, what do you want? I want to do well. 100% of our kids are saying, I want to do well. I don't want to make my parents mad because of me. But they don't know how to. Instead of teaching them how to, we're just yelling and scolding about their behavior. How many times I have to tell you? Stupid. Your relationship matter, and how you respond to our children matter. It will shape the way they think about themselves and about you, and how feel about themselves. And then things that they remember. Okay, As I said, these signs, ADHD and both ASD, is neurodevelopmental. That's why it's a developmental disorder, because it's starting it early. So we have to be mindful and watching, and something is not right. Well, one of the ways you can see is something that makes you frustrated. That's a sign, unless you have your own issues. Maybe you have your own problem. Like I said, it's a genetic. The reason why you have a hard time to kindly, gentle way of doing it, because you have the same symptom. You cannot be patient. You can be impulsive. If you're repeating the same things over and over again, it is redundant and boring for you. Maybe that's why you're shouting, right? So we have to address our children and then see if anything that make you feel that they are supposed to, but they are not, then it is developmental. The reason why we are feeling that way, because we have our own social expectations. By first grade or second grade, they are supposed to do something. If they are not, then something that you have to consider. And also strongly related with the parenting. A lot of the Asian community, we overly nurturing them, overly protecting them, and disable their ability as well. And almost like enabling and spoiling our children. Okay? So early dictation is very, very key. So as I said earlier, ADHD particular, if it is more of ADHD conditions, if they receive treatments early on, it's almost like over 90% it can be cured. And almost like they don't seem like having it with the treatments. And becoming an adult, they will be able to manage, because during the developmental, in their brain developmental, they learn how to manage with their potential, their ability. But untreated ADHD can also cause not only attention-related issues, but depression and anxiety comes along with that later. Because it is affecting their view, like I said. If they fail, we tell them, you're stupid. Then that becomes their identity. Then now it is affecting their identity, which means they will always feel themselves bad. I am bad, I am stupid. Right? So early treatment is always important. ASD, again, is a neurodevelopmental disorder, but is not curable yet with our current medicine. But they can help them to manage, because it's brain chemical imbalance issues. So aggressiveness can be controlled, impulsivity can be controlled, meltdown can be reduced, and then they can focus work that they do. But still, socially related issues that has to be treated by therapists, so they can help them how to communicate with other people, how to read the room correctly, how to respond with a question instead of saying mean things. Okay. There's a lot of behavior treatments as well, but one of the most important thing is parenting skill. You have to understand what your child has. Again, it's not about them. It's a brain function and how brain grows, right, and function. So we have to understand, not penalizing them and judging their behavior, but protecting their being by helping them to shape their behavior. Is all about the parenting job. Our parents' job. And then coming to the church, that's also we needed to do that as well. Okay? And then social competency, the reason why instead of a social skill, I put the social competencies, because each age we have a social expectation. So if they didn't learn how to engage with other people as a first grader, if they didn't learn, they went up to the second grade, then they are missing that part. Now they cannot connect with the second grader friends. So we have to help them going back the missing and delay area to teach how to communicate, how to share things, so that at least their delay is not too much. So still they are able to connect with their peer groups. Okay? So again, executive function is a very, very important part. Either ADHD and ASD, their biggest struggle every day is executive function. How to manage their time, how to organize, how to structure, how to unstructure, how to rest, how to feel relaxed is all related to the executive function. So we have to teach our children, either they are ASD or ADHD. Executive function is one of our therapeutic goals to help them. Again, if it is a behavior is too severe that parents cannot manage or it affects the other siblings at home, then we recommend specialized people who are trained for those behavior issues. We call it ABA, to send home or going to the center to learn about that. Typically, in our clinic, we send our therapists to home so that we can shape the environment's changes rather than the child behavior. Okay, again, therapy, and then school-based accommodation is also very important. A lot of Korean parents don't know this is available for their children at school. School-based accommodations is legally protected for our children's right in academic setting. If they are due to the ADHD or ASD, it affected their academics, legally, school needed to protect and support with accommodation. So if you see that their behaviors are related or affecting their relationship and the school, at least us, school teachers can help resources for parents how to apply. At least the teacher can ask the school, can you accommodate? Even that one word that school cannot ignore legally. And sometimes if it is conditions are little hard to manage, then school district will pay for the even private school education until high school age. So there's a lot of accommodations are available, so we needed to help them because it's related to the neurodevelopmental disorder. School, by law, protect that to get the help. Another thing that what we needed to really mindful about the medication management. Asian Christian community, we have this interesting stigma about the medication. And I agree that that is really bad, right? When I was in Korea, we have this package. You don't even know what medicine is inside, but you just have to eat breakfast, lunch, and dinner. America is not like that. You know every medicine and how it will affect their brain function. So we have to let go of our perception and our stigma about the medication. It is not about you. Your children and our children at church are struggling. And then people are naming them with that behavior. We have to help them to get treated. Okay? And then, again, a lot of these issues are already addressed in our first lecture. We have to be aware. And if it is beyond our ability, if you see that you are losing yourself as a teacher and parents, seek professional help. And you can salvage your relationship with your children, not damaging your child and their view about themselves and you. Okay, another thing that what we needed to also be mindful and always remember, every human being with God's image, the way God created us, has some strengths and weaknesses. ADHD, ASD, yes, there's some challenges and difficulties and weaknesses, but they have a strength too. Do you know there's a Silicon Valley area, if you are applying your job, sometimes they're asking for, do you have ADHD? Because they want your ADHD brain to be more creative. Because ADHD brain is, at the moment, they're really good. They just don't do well like a long-term project doing by themselves, But they can do really well, like a quick response or very creative. And then they're very empathetic too. Because they themselves going through this a lot, they know how to empathize other people, and they're very passionate about curious. Everything is so curious for them, right? So, they're very adaptable. The changes is okay for them, right? Any school, and then going to the mission field, they can do really well. And also there's a strength in ASD. They are very hyper-focused oftentimes, because once they are interested in something and locked in that interest, they will know until they get it. And their brain framed very differently. I use this guy a lot, not that because I like him, but because everybody knows him. Elon Musk is also high-function autism, because he's so good with what he's good at it, but he openly discussed in public the reason why I'm not good with the people because of my condition. So don't take it personally when I say mean things, right? So, but they are very analytical, and also their memory is beyond that typical and norm atypical individual. And then they are visual thinker, not auditory. So they are visual thinkers, so the things that connect and pattern is beyond your understanding. So if we are able to give them the way that they can learn, the way that they can use their strength, they can change our society and culture in a sometimes better way. And they're very honest. Sometimes you cannot handle it when they are saying honest things. Mom, you're not that pretty. Maybe you can handle it, but they have their own view, right? So they can be very honest, but the honesty or integrity has to be valued rather than be penalized with that. So we have to understand they have a strength and also benefit of their condition. But the bigger thing is what we need to understand, as we shared earlier, that it is a human being. So I wanted it to kind of conclude with this. As a Bible verse, probably we all know growing up with encouraged by these verses. Just pause for a second and read. And think about the children you under your care and children you raise. And think about that. Nothing. Even with their condition. Maybe this society cannot accept. Our school system cannot accept. Or maybe my standard cannot accept. But nothing. Even including all of your view, cannot separate them from love of our Christ, Jesus. They are also made by His own image. They are also human, same to have a feeling like you do. They are the same to think the way you think. It's just a little different. They all wanted to be seen and loved by you. And God put us in their lives to experience their love and care so that they can learn from us. It's not about the condition, but it's who they are. It's matter. As a teachers and as a parents, again, we're not dismissed that this is easy. When you are going through this every day as a teacher, you may not be able to. Maybe that's why sometimes we have to allow ourselves to have a little bit of a space to care and have a community who can understand this and doing this together. I believe that's why we do have a church. That anybody can come and experience the love. Thank you. And then again, same information. If you have more information and wanted to know beyond more of what you can do, requires some professional help, Alice is very, very well trained in this area, both ways. And then also we can provide some assessments too, that if you want to know that what is it, right? And then you need some school accommodation, we will help. And let us know if you need help. Again, these are all the resources that you can have or access. Care, the first one is, Dr. Esther mentioned that if you do have a commercial insurance, we do have a clinic that you can use your insurance because it's ongoing treatments. It's not cheap. So if you can, please use that. And there's many other textbooks and articles you can read and understand a little bit more. And also you are more of a parents or teachers who want to understand more about ADHD, the Attitude Mag is a very, very good resource. You can understand a lot about that. And then, again, this is the kind of area that is kind of far other than our South Pasadena or our Beverly Hills office. But if you need more of a bilingual services, if our clinic is not able to support you, Psychology Today, if you typed Korean or types of the services that you need or area that you want to go, it will kind of come up with people who you can contact to. And the Fully Health, again, as we said, is a donor-funded clinic that if you don't have insurance, but we believe that money cannot be the issue that your child, our children cannot receive services, so we subsidize. So if you need help, please let us know. That is the Fully Health. Then our staff will help you how to subsidize to help your services that you need. Okay, thank you. Now I'm going to invite Alice and do the Q&A.